Question number 30. HRG shows bilateral areas of consolidation, predominantly and peripheral distribution, ground gas capacity in the middle and upper zone, with slightly diagnosed chronic eosinophilic pneumonia. In chronic eosinophilic pneumonia, there is peripheral consolidation. So, in HRG, bilateral areas of consolidation, predominantly in peripheral distribution, consolidation and peripheral distribution, and ground gas capacities are seen in chronic eosinophilic pneumonia. 31. HRCs with multiple small central lobular nodules of soft tissue innervation connected to linear branching capacities. Most likely cause of this finding is enterobronchial tuberculosis. Important is nodules connected with branches seen in enterobronchial tuberculosis. Multiple small central lobular nodules of soft tissue innervation connected to linear branching capacities. Question number 32. Sjogren syndrome. HRCs was few scattered, well-defined regular lung cyst. Mild, mediastinal, and high pneumonopathy, most likely diagnosed pneumocytic encephalitis pneumonia. Sjogren syndrome is associated with pneumocytic encephalitis pneumonia. Sjogren syndrome is an autoimmune disease that is associated with lymphocytes and is so a patient has Sjogren syndrome and a lung disease, so most likely it is lymphocytic encephalitis pneumonia. 30. Which statement regarding aortic femoral artery aneurysm is false? Ultrasound cardiac compression is the treatment of choice. For femoral shoulder aneurysm, which is false, ultrasound cardiac compression is not the treatment of choice for femoral shoulder aneurysm. 34. A 2.8 cm lesion on chest X-ray. A second lesion in the right lower lobe, 1.2 cm in size, not visible on chest X-ray. 2.8 cm ipsilateral peribronchial lymph node. No metastasis. Perhaps it was non-small cell lung cancer. What is the stage of the lesion? Stage 2B. Because the lung cancer, and it is less than 3 centimeters, so stage no. Okay, there are two lesions in the lung cancer, so it's stage 2. And then stage 2B, this is 34. You will write this in the end. जी
वो आपने कल के लिए TNM यूज नहीं करते, तो अभी इस क्वेश्चन में आप कह रहे हैं कि स्टेज
नॉन स्मॉल लंग कैंसर है, ठीक है, perhaps it was नॉन स्मॉल सेल लंग कैंसर. पीछे एमसीक्यू में था स्मॉल सेल कैंसर, तो उसके लिए हम TNM यूज नहीं करते. अच्छा, इसकी स्टेजिंग एंड में पढ़ेंगे या अभी तो एक्सप्लेनेशन देख लो?
सर अभी पर ये इम्पोर्टेंट है.
ठीक है, ठीक है. ओके, इसमें यह है कि जो है बस 2 लेजेंड्स है, तो स्टेज 2 भी है, ठीक है. फिर तो कॉम्प्लिकेटेड है. ये क्या है कि पहले जो है टी स्टेजिंग में है कि लेस देन 2 सेंटीमीटर T1A, फिर 2 to 3 सेंटीमीटर T1B है, और 3 to 5 सेंटीमीटर T2A और 5 to 7 सेंटीमीटर T2B है. 5 to 7 सेंटीमीटर T2B है. ये है 2.8 सेंटीमीटर लेजेंड. तो ये तो कॉम्प्लिकेटेड है, एक्स्ट्रा स्टेजिंग है इसमें. बस ये याद रखो कि जब 2 लेजेंड्स हो लंग कैंसर में और फिर स्टेजिंग के पूछ रहे हो तो मतलब स्टेज 2B, बस इतना याद रखो. बाकी डिटेल में ये कह रहा है कि स्टेज 5 to 7 सेंटीमीटर स्टेज 2B है, लेकिन ये बहुत डिटेल में देखो. TNM staging, देखो, subclassification added to T1 with legends of less than 2.2 cm being T1A and legends between 2 and 3 cm being T1B, legends between 3 and 5 cm to T2A and between 3, 5 and 7 cm to T2B. Legends over 7 cm T3, correct? The absence of metastasis is obvious, thus the patient is T3 and 0 M0, which corresponds to stage 2B. ठीक है. Because 0.8 cm is lateral, no metastasis seen, and then 2 lesions in the lung, so most likely change stage 2B. Question number 35. Splaying of the crania and double right heart border, most likely diagnosed mitral stenosis. Question 36. Which feature would be in keeping with Klebsiella pneumonia as opposed to pneumococcal pneumonia? Bulging interlobular pituitary shows Klebsiella pneumonia. Question number 37. A manual worker such as numerous small nodule densities with respect to occupational lung disease, which cause is least likely to result in functional lung impairment, cirrhosis. In occupational lung disease, least likely to cause result in functional impairment is cirrhosis. Question number 38. Male smoker, HRCT, was bullied with basilar predominance, likely diagnosis is alpha-1 antitrypsin deficiency. When they are bullied with basal lower lobe predominance, diagnosis is alpha-1 antitrypsin deficiency. Question 39. 30% of all lung cancer typically occurs peripherally. Which lung cancer is being described? Adenocarcinoma. Adenocarcinoma is a peripheral lung cancer. Squamous cell carcinoma is central lung cancer. 40. CT chest shows multiple areas of ground glass attenuation, crazy pain pattern, and consolidation in both lungs. Spleen and liver have increased attenuation. Most likely explanation, amiodarone. When spleen and liver are increased attenuation, the most likely diagnosis is amiodarone toxicity. Question 41. HIV positive IV drug user. Just agrees with bilateral perihyalar fine reticular opacity. Most likely diagnosis is pneumocystis jirovecii. In HIV drug abuser, most likely diagnosis is, and then after that, bilateral iron infiltrates. Diagnosis is pneumocystis jirovecii. Question 42. Consider bronchiolitis is suspected. Which finding on the RCT is likely to be more self-limiting diagnosis? Air trapping. Consider bronchiolitis RCT shows air trapping. 43. Solitary pulmonary nodule. Which feature suggests that it is benign? General pop-lung calcification shows solitary pulmonary nodule benign. 44. CT shows a lesion with an enterobronchial component which narrows the airway significantly. Lesion has triple calcification and no cavitation. Lesion hinges abruptly in the arterial phase. These invasive means of follow-up imaging for diagnosis is indium 111 occultized single photon microscopic tomography aspect. CT diagnosis carcinoid. Now the triple calcification and then enhances abruptly in arterial phase and enterobronchial component. So enterobronchial triple calcification and enhancing abruptly in arterial phase means carcinoid. In carcinoid, we do least invasive measures of investigation in carcinoid is indium 111 occultide study. Question number 45. Non-proctolic cough and dyspnea preceded by a flu-like illness. Focal areas of gum glass opacification. We are surrounded by smooth walled ring of consolidation. Most diagnosis, complex representative organic pneumonia. Now, smooth wall ring of halo. Look here, non-proctolic cough and dyspnea, flu-like illness, GGO, smooth wall ring consolidation, smooth ring lesion is seen in cryptogenic organic pneumonia. Smooth rings are seen in cryptogenic organic pneumonia. Smooth wall ring is seen in of halo. So smooth ring surrounded by gum glass opacification is called smooth wall ring halo, seen in cryptogenic organic pneumonia. 46. Failed to improve with initial antibiotic therapy, most likely diagnosis mycoplasma pneumonia. 47. 51-year-old female woman with intestinal fibrosis. Which part of lung is likely to be relatively spared by intestinal fibrosis? Posterior aspect of lung is spared in intestinal fibrosis. 48. Male smoker. HRCT shows complex thin and thick walled cysts and irregular frontal lobular nodules in a similar distribution with spraying of the patient. The remaining lung appears normal. Most likely diagnosed Langerhans cystitis. There is seen in male smokers and then nodules with sparing of the bases, with nodules involving the mid and upper zones and middle intervening lungs is normal to diagnose like LCH. 49. Undergone a cardiac transplantation. 3 months later, post-op, chest x-ray was diffused right side airspace infiltrated. CT scan shows patchy areas or airspace consolidation with sounding on the changes in the right hemithorax. Area of cavitation in the right upper lobe with surrounding halo of gum glass change was appropriate first-line treatment. Systemic amphotericin, because it is for aspergillus infection. We give systemic amphotericin. Now he underwent cardiac transplantation and then he became immunocompromised. When you get immunocompromised, such agent was diffused right side airways infiltrate, and most common after cardiac transplantation, you get aspergillus infection. There's a surrounding gum glass change, and then you have cavitated in the right upper lobe with surrounding hollow of gum glass change. So he's getting aspergillus infection. The first line treatment is systemic amphotericin. 50. Male with chest pain, dyspnea, and palpitation. Amyloid to scatter delayed enhancement in the anterior, lateral, and inferior wall and apex of the left ventricle. Later spraying of the subendocardial region, most likely diagnosis myocarditis. The spared subendocardium shows there is no ischemia. Here, is to diagnose myocarditis. When scattered delayed enhancement in the anterior, lateral, and inferior wall is myocarditis. Question 51. Suspect H1N1 influenza swine flu. Which finding on chest X-ray is the most strongly predicted of an adverse outcome? Multizonal peripheral opacity. In swine flu, when it progresses and it shows adverse outcome, so and that will be multizonal peripheral opacity. Multi-zone and peripheral opacity in swine flu is a poor outcome. Question 52. Mosaic adrenaline pattern, which confirms that the loosened areas are the abnormal areas and you are not dealing with multifocal congress opacities to each caliber of vessels and loosened area. When there's chronic thromboembolism, there will be mosaic adrenaline pattern, and in the loosened areas, there will be decreased caliber of vessels in the loosened areas.